Hello everyone, welcome to our webinar for writing a scientific abstract, a case report and a research poster. This webinar will be in English because it's for both our outgoing, some of who are international students, and also our incomings, all of whom are international students. My name is Jordan and I'm the National Exchange Officer of AMSB. Also our incomings, all Can you hear me?
Yeah, now it's okay.
Yeah. Okay, you can present yourself as well.
Yeah, hello, I am Cvetan, I'm the National Officer of Research Exchange, and because Jordan cut out, he's the National Officer of Professional Exchange, current one.
Sorry.
Yeah, and now we are going to present the agenda on this webinar. Yes, and we are going to introduce you why we are doing this webinar in the first place. First of all, we are trying to increase the academic quality for both incomings and outgoings through our exchanges, both research and professional, because, how should I explain it in 2 words, academic quality is the thing that you actually learn from the exchange in the end of it, which is going to help you further in your career as a doctor and a student also. Also, we are doing this webinar because we are going to promote peer-to-peer education as part of a post-exchange debriefing and or in our National Assembly. This is for our outgoings. When you fill in your case report or research poster, you can present it to your peers and so uh, like present yourself as being a better student and also get something out of they will get something out of it and you want to go and uh, maybe do the same. Also, you will learn how to do research work and present at a congress. This because part of what we are trying to teach you with this webinar and what we are going to try to teach you if you actually complete what we have set out to do is how to fill in a scientific abstract, case report, or a research poster, which is the easiest thing you can do as a student at the moment and as a doctor, of course. If you want to pursue a career in research, this is like an integral part of the whole process. And the last part is that for in our exchange conditions for research exchange, for getting your certificate, you must present a research poster, like you must send it to us in an online form, in order for you to get your certificate. And for now, it's a recommendation for the professional exchange to do a case report, but we will see how things will go, and maybe it is going to be uh, a requirement maybe next year. Who knows? But now Jordan is going to present to you how to do a scientific abstract and a case report. So I'm giving the mic over to him.
Thank you. To understand why you should write why you should be able to write an abstract and to read an abstract, first you have to start with asking yourself the question: what's the purpose of an abstract? For every different type of medical research, in order for you to do a publication or to present your work somewhere at a congress or at a national assembly, you always need to first send out an abstract that needs to be approved by the organization in order for you to present your whole work. So either you can write a journal, which I'll give you an example of different journals throughout the world, or you can present live as a PowerPoint presentation or a poster session. But in whatever you do, you always need to be able to write an abstract. And as a medical student, for now, you can't participate in all types of medical research, but what you can do is you can write a single case report or case series, and you can participate in every type of basic research, which is usually in a laboratory environment. as part of your, for example, your research exchange. But also because your research exchange can be in a clinical setting, you need to be able to, you need to know how to present a case report. It doesn't matter what you present in the end, it all starts with an abstract. So whatever the publication that you will do, the first thing is an abstract, which is like a summary of the whole scientific article or your presentation that you have prepared, and then come all the rest of the article. But the abstract itself has a similar, just a summarized structure of a scientific article as a whole. So to begin with an abstract, before I show you the structure itself, I want to give you a few examples just to understand why you need to know how to read and prepare these abstracts. For example, this is JAMA. It's the Journal of American Medical Association, and it's one of the most famous journals that you can participate in as a doctor. But it's a good start to see how an abstract is written. So I've just when you go to websites like this, you can pick at random any abstract. I've just picked the one that was posted this year and had a high rating. But whatever abstract you pick, that's the beauty of it, that it's always written in the same way. So if you learn how to understand abstracts and to prepare them, you'll always be able to find the information that you need. So this is important not only for you to present, but also to find whatever you need in your studies or in your work, because in medical journals, always the most relevant information is posted, everything that's the newest. So instead of you searching throughout the textbook to find some information that might be outdated, the best way to do it is to go and see clinical tests, cohort, research studies, everything that you need for the information that you require. So I've picked an abstract here that's called non-invasive cardiac testing versus clinical evaluation alone in acute chest pain. So for example, this abstract, it starts with this title, which is catchy for me if you want to compare these two settings. This abstract just compares two methods of treatment of something common, which is the acute chest pain. It starts with, you can see the structure here, which I'll show you in another abstract. It's also the same. In JAMA Internal Medicine, you can look for all types of abstracts every day. For example, this one has 13,000 views, and there are thousands of abstracts posted every day. So it's really important for you to understand how they're written. I'll get into detail this now. Just want to show you another one. This is in the New England Journal of Medicine, which is also another famous journal in the world. It's, for example, this one tests how monoclonal antibody is how efficient it is in treating uncontrolled asthma. So, for example, now the using monoclonal antibodies is the newest way in treating asthma. So this is how you can keep in touch and update yourself constantly of the new discoveries. For example, this one shows, it starts with explaining what this medicament, this drug is, dupilumab, and then gives you everything that in this research was done. So it compare two target groups that were treated with one drug versus another target group that was treated with a placebo, and what is the outcome. I will show you now the structure itself. I just wanted to first give you an overview of why you need to write an abstract, or why you need to be able to read an abstract. Because if you're interested in this topic, for example, you don't have to read a whole journal which is 50 pages on how this drug exactly interacts, or go to a congress and see a person present their research. All you need to do is to see the abstract, which is a summary of all the research that has been done on this topic, and then you can understand if that's what you need and go into more detail. And it's important because most people that look for information, they're not going to read 10 journals every day. They're not even going to read probably the whole abstract. But this is the first thing that they'll see, the title and the abstract itself. So you have to start from this with whatever research you want to do. You have to learn first how to write an abstract. And with all these websites, when you visit them, there are thousands of them, really. And you can find everything that you need. For example, here in Elsevier, it's given as a search bar, and you can just type any topic that you need in any field in science as a whole, but specifically now in medicine, and look for abstracts. And every research paper is presented first as an abstract. Now, to give you more details about what actually the abstract is, first I want to show you why you need to know it, but how to write an abstract and what exactly it is. As I said, the first part of any scientific article is abstract. And to begin, you need to know that generally all the abstracts in every journals have a similar general structure, but you'll find some differences depending on where you want to present. So, for example, if you want to present at a congress or if you want to be published in a different journal, they'll have some specific requirements of their own. But if you know how to write an abstract as a whole, then there will be just slight differences. Overall, the structure is the same. For example, here in JAMA, they want first for you to write the importance. So why are you doing this? Why have you done this research that you want to present? And the objective, what was the aim in the end? Then you go to design, setting, and participants. You see now when I show you the other example, is the same thing just with different words. For example, in the New England Journal of Medicine, they say methods, but design, setting, and participants, it's the same. It's your target group and how you test it between different target groups. And the main outcomes and measure. This is probably the most important part of any abstract, because most people that read an abstract, they'll see the title, see if they're interested, and then they'll see, because they might be already familiar with the topic, and then they'll see what you have achieved actually in your research. So here, in the main outcomes and measures and in the results, so that's actually the two parts that are most important, you need to show what was the result of your work, and you need to give specific objective examples. Here, you can write something more abstract as a sentence, but here you have to be very specific to give a results of the treatment, to compare with different control groups, and to give a conclusion in the end of whether, for example, in this case, for example, whether one or the other method is better suited in a different clinical setting. For example, when there is acute chest pain. So most people will see the results, what you've achieved, and see your conclusion. So in this part, it's very important to say also that it doesn't matter even if your research didn't bring any positive results. For example, it doesn't matter if you didn't prove that this drug is more suitable to treat asthma than the drugs that we're using now. What's important is for you to be objective in your research and to give the results exactly as you've encountered them in your research. So even in the conclusion, if you say, we concluded that the two groups react the same, so there's no improvement in using one drug or the other, it doesn't matter. You just have to be objective about it. That's what people look. So you might help someone, even if you tell them that drug is not effective, because they know that they will focus their research somewhere else. Now I'll explain to you why I was showing you how to write an abstract in the context of exchanges more, because abstracts are just the beginning, but what we want from you. Just 1 second. What we want from you is to present a case report for professional exchange. The idea is that we are not expecting people to actually write a whole abstract and send it to their exchange officers. Why we included this part with the abstract was that if you're interested in this field, if you want to do research work, you always need to be able to write an abstract. But now, just for the exchange part, it's important for you to know how to write the case report. So let's say that you go to a congress and you want to present a very interesting case that you encountered in your practice. If you're at the congress, you would first need to write an abstract about this case report, send it. If it's approved, then you will go to this congress and present your case. It can be at like, for example, with a PowerPoint presentation. For us, for exchanges, all we need from you is to fill out this template to present a case report. Now, before I show you the different parts of the template, I want to show what exactly a case report is. I want to start with that to say that every day in your practice you will see different patients. The idea behind writing a case report is when you see something unusual, something that's out of the ordinary, and you want to present to other people so that they can learn from what you've already encountered yourself, then it's the best time to write a case report. So case reports are for rare diseases, for to remind someone of an important clinical lesson, or in most cases to show an unusual presentation of a common disease or injury. So if you encounter patients that have common presentations, it's not something that you would want to present in a case report. But if it's an uncommon presentation of a syndrome, for example, like in this example, then it's a good place to begin to write a case report. So before I show you how you can prepare one yourself, I'll show you one from the British Medical Journal. It's a case report about this blunt white garland syndrome on coronary CT angiography. So this one focuses on how this syndrome presents in an angiographic study. Case reports can include anything really. It can include any documentation from the patient history or physical examination of the patient, or it can include anything from the laboratory or image studies. This one here, it describes what the disease is, how it usually presents, and what's the difference in this case in the description. It's given, it has given images, and then probably the most important part is it shows why the author says why he presented this case, what are the learning points, so the idea behind this case. This is the most important part of a case report, and I'll show you now how you can do it yourself. In our template that we've prepared for you and that is shared in the description, this is the template for AMSB's case reports. Just from the point of view of a person that's going on exchange, what you need to know is that you just have to fill this out. You have to find a patient that's interesting to you, that has an interesting case, or you have to speak with your supervisor to find the documentation of an interesting case that you can prepare to present. You need to fill this out and send it to us. And it might seem a bit complicated in the beginning, but actually it's really simple, and it's something that you do every day in your everyday practice as a medical student, and then as a doctorate you'll be able to do. So first, you have to make sure that this patient has consented to them for you to use their information. You don't need to use their personal data. You don't need names and photos of their faces. You don't need personal data in any way to expose them, but either get their oral consent or print this consent form that we've prepared for you and have them sign it. Then this is the first part, and after you have their consent, then you can use their information, not their personal information, but the information that's relevant to their medical case, for you to prepare a case report. You need, the first part is the title, which is, as I said, with an abstract. So the case report is a bigger part. The abstract will be a summary of case report. But if you write a case report, it's your whole publication. The title has to be like in this example that I've shown you. The title has to be something engaging, something that catches the eye and makes a person want to read your publication. In this case, your case report. You have to think it yourself and not to include a case report. Then it's not given here, but you have to also, in this case, you will be the sole author. But you can also provide the names of the people that you've worked with if there are more people that have worked on this case. Background is, in this case, is background. In some place, you'll see it as introduction. It's very important for you to say why you chose this case, and then later in the learning points, you emphasize on this, because it's the most important part. What you want to show with this case, why you're presenting it. If it's just a normal presentation of the disease and it won't teach someone nothing new, then there's no point for you to make this case. So this is very important. In case presentation, in investigation, differential diagnosis, treatment, every part, this is self-explanatory for me, I think. Every part in case presentation, it will be the patient, the complaints of the patient and the patient history. Investigations will include your physical examination, laboratory, and image studies. Differential diagnosis, as I've written here, if relevant. If you haven't done a differential diagnosis, it's okay. You can still present your case report, but in the ideal case, you will do this as well. The treatment plan that you have you have made for this patient with your supervisor, you can write it here. And what was the outcome and follow-up, if you had a follow-up. Again, most of these parts, if you haven't done them, it's okay. It's what's important is for you to focus on why you do this case report and what you want to show the people that you're presenting. here in the discussion, you can write this, and also in the learning points as bullet points, you can, as you see in this example, the learning points. I'll give you the links to all examples so you can take see them yourselves, but you can always go to any of these websites that I've showed you, the British Medical Journal, the New England Journal of Medicine, and all others, to see case reports like this and to see how you can write it. So as you can see, we've made this only for you to be more structured to you. And this is what you need to prepare to learn how to present a case report. But in the end, ideally, that's what a case report that you present would look like. We are saying this only to help you to raise your interest. I can teach you now. I don't even know myself how to perfectly write a case report. But as long as you have interest in this topic, you can always look at this and read case reports and teach yourself how to do them. But for us, for exchanges, that's enough to complete this template and to send it to us. And it will be reminded to you how to do it by your local exchange officer in your outgoings groups. And you'll be it will be requested from you to send them to their email. And in the end, what I didn't mention is very important, also both in abstracts and in case reports, is to reference if you've used any literature that's outside of what you've just encountered yourself in your practice. So if you use anything to improve your case report, any literature, you need to put it here. And to make it easier for you, we've also given you a link to a Harvard-style generator where you can just paste links, and they will generate the reference for you, just as long as you paste the link here. In the end, just before you send us this template, please write your name here and date. This only means that whatever you send us, we can use it as well. We can show it to, for example, other people that are going to an exchange or to our national assemblies. But of course, we'll talk to you about this later. For now, then we'll present you to you what you should know about the research posters that are relevant to your research exchanges.
Okay. Am I sharing my screen yet?
Yes, I've shared your screen. They're looking at your screen now.
Okay. So as you can see, we have another template. So templates here make it extra easy. For scientific poster, it's quite the same. The only difference is that you can see that you don't. The only thing here is the copyright statement. But I will explain more. So first, this is the template that you want to use. Here's, you can see there's. Am I still sharing my screen though?
No, we can see.
Okay, I'm sharing my screen, I guess. So you can see we have made a template again for a scientific poster. This is pretty standard stuff. This is maybe the most used dimensions of a scientific poster. And we have put all the required bases that you must fill with a short description of what must be included in the introduction, in the method, procedures, results, conclusions, etc., etc., and the references as well. Here you have a description of how you should fill the authors. You cannot see it here, but you should download this template on your computer and fill it in. Ideally, you should try to ask your tutors for help. I will say that it's most mandatory to ask them for help, and of course permission to use the results of the research, and let them help you with this because they have more experience than you, and this is how you will learn. As you can see, Jordan already explained most of this stuff. It's pretty much the same as a case report because you can make a poster about the case report if you want. That's what I was going to say also, because sometimes either the research is already done or the tutor doesn't want to allow you to use his data. Then if you're in a clinical research, which in Bulgaria at least it's very common, You can ask them if they can help you with making a case report. Then you can use the template that Jordan showed you, or you can make it into a poster. It's up to you. We will accept it either way. So what also I wanted to show is the two examples we have shown you. One, this one is from one of our outgoing students. Made a very nice poster, as you can see here. Everything is filled in. He has pictures, and his research was basic research, basic science research. I mean, in a laboratory, as you can see, he got to work with uh, mice, and of course in a laboratory. Also, when you're just as a how should I say, a tip, you don't have to format your pictures when you're posting them on a poster. This is not uh, arts poster, how should I say. The only relevant thing is the information. Also, you should try when you're formatting your poster is to try to have flow, how should I say, because when somebody is reading the poster, that's also a tip when you're doing it for a congress or something, they're gonna either read it like this, like down, up, or maybe you can do it like this. You can find a lot of tips and tricks online on how to make your poster look better. And if you're, as Jordan said, if you're trying to write a poster, you can look up other posters to get ideas. This is not a originality contest. It's all about the information in it. The other example is from one of our incoming students. Uh, as you can see, she had a more clinical case about 6-minute walking test in patients with COPD. Uh, Very simple, very short, exactly to the point. She also wrote her tutoring because he helped, and you should also. Uh, Other than that, uh, from let's return to the template. Other than that, this is just general information is the same. A link to the webinar as well. Also, you must have signed informed consent or oral consent, as Jordan said. If there are any patients involved, if there are no patients involved, for example, you're working only with mice, then it's okay. Like nobody cares. But if it's for patients, ideally you should have that. If not, it's not that big of a deal because the tutor allowed you to do it, but still keep it in mind because ethic commissions in the future as a doctor are a big thing. Also, when you're sending the template filled in, you should also set this copyright statement is the same as for the case report. It just allows us to use the thing that you have sent us and share it and show it to other people so that they can learn something. You have full authority to use the poster as you wish. When you go home, you can present it at Congress, everything. It's up to you. Other than that, I don't know. I think I have finished explaining. But also, if you have questions, please ask your local officers about any questions that you have. They are your main source of information. And in the end, you send the scientific poster to them with the consent form, this copyright statement here, where you just write your name and the date. And after that, you get your scholar certificate for research exchange. And that's about it. We hope that this webinar was useful to you, and
I
Maybe,
just want to add that, as you said, for research exchange, it's mandatory
yeah.
to complete this, to send a research poster. For professional exchange, it's not mandatory, but we're trying to introduce it this year, hopefully to become mandatory in the future, so that all people do it, in order for us, as we said in the beginning, to engage in peer-to-peer education. I would also like to mention for our outgoings that if you present a case report or research poster at a post-exchange debriefing, which we hope to organize after in September or during the National Assembly, whenever we organize it. If you present, you'll get bonus points for your next exchange. So it's a good opportunity also to improve your chances of going at a better exchange, hopefully the following year. And just to recap before we finish, we are showing you all this not only because we want you to send us stuff. We hope that the exchanges are a way for people to learn how to engage more in research work and to present, to be more organized. We don't expect you to send us abstracts, but we hope that now we've inspired you yourself to look more, to search for more information. We can teach you in 30 minutes how to present scientific abstract, case report, research poster, but we hope that we've raised your interest and that you research more yourself on how to present these things. But as Setan said, we're always here for you. If you have questions, turn to your local exchange officer, or local officers on research exchange, and they will surely help you or ask us. And just to finish, do you have anything else to add?
Well, no, you pretty much
Yeah.
recapped everything. Just also have a good time in Bulgaria, and for the outgoings, have a good time on your exchange, of course, and have fun, my friends. This is also it's no all work. You should go and have a social life as well. But please try to set these things because for us, for research, as Jordan said, it's mandatory. This goes both for incomings and outgoing students. For professional, it's a recommendation for this year, but maybe next year we'll see.
And your local officers will remind you before the end of your exchange to send this. Give you links. Don't worry if you can't find something right now. We'll try to share everything in the description, but we also the local officers will also share everything that you need to know with you. So the templates, the information where you need to send it, and as I said, you can ask them for more information every time, whenever you feel like it. So thank you very much for joining us. We hope this was useful for you. And follow our channel. We'll have more webinars in the future.
Subscribe, leave a like, leave comments below. We read every one of them, every
Yeah, yes, very
because
rarely.
it's only one of them. But yeah, thank you again very much for joining us from me as well. And again, hope you
Have a good
have
night.
a great exchange. Okay?
Yes. Goodbye.
Goodbye.
See you.